I first worked in Chicago at Northwestern University, and then I was recruited to San Diego to build a large program of patient care, education, and research.
I trained in internal medicine and then radiation therapy for patients with cancer, but I quickly moved into doing palliative care in that setting. As part of that, I got to also grow an international program, and today our international programs are training physicians who want to be palliative medicine specialists, as well as training physicians who are already specialists to be effective leaders, and we're doing that in about 35 different countries.
The reason to come to OhioHealth here in Columbus is that the next phase of palliative care development is part of healthcare systems. In San Diego, I was working at a single institution with collaborations. That's not the same as working inside a system. This family of 21,000 associates, more than 9 hospitals, home care, hospice, outpatient clinics, a sense of belonging to Central Ohio, and claiming that as its mission to care for these people in Central Ohio, that seems like a terrific challenge. I want to be part of that kind of a team, and I want to help build the vision of a healthcare system that includes palliative care throughout the system, from diagnosis, woven into the system. It's not something that only specialists do. Everyone needs to have some palliative care skills.
Palliative care is the medical specialty that focuses on symptom control and supporting patients and their families.
We know that when someone has serious medical illness, they suffer in a variety of ways. They suffer in the physical dimension. They have pain, shortness of breath, fatigue. They worry. They may be angry. They suffer in the context of their families, their relationships. They also have challenges just in practical issues. How do I get to the doctor? How do I get my usual things done? How do I work? And of course, they suffer in the spiritual dimension. Why is this happening to me? Why didn't this happen to someone else? If we're going to take care of people in the context of their families with serious illness and do it well, all of those dimensions need to be addressed. That's what palliative care sets itself to do.
Of the patients living with advanced illnesses or dying in America, in spite of being well insured, 30% of those families had someone who lost their future because they needed to be a caregiver. 30% of those families became bankrupt, actually paying for the care. If we can put together an effective palliative care system here in Columbus and Franklin County and the region around through OhioHealth, we can potentially make sure patients are in the right setting to get the right care at the right time with the right funding models. And we can really help empower the caregivers who are in the family. I think in a long-term effect, we will impact both sort of the social factors that go along, such as lack of employment, loss of future, and we may even impact some of the economics of that.
What's going to help OhioHealth and help the community is knowing that all of the healthcare programs that are offered are stronger, that the suffering, the pain, the stress are going to be addressed as part of their healthcare team. That's what's exciting. That's the power of palliative care.